Ki khubor ka Batesi TV.
Ka umdi basnyam bat penjasliang. Rupa Premium Meghalaya. Ka East West Group of Institution Bangalore. Ka khot admission nagamta ka nursing but paramedical course. Ka bala ithu da ka Indian Nursing Council. Ka buy admission ka badunatam. But she's pa percent ka jinyokam. Pila ru ban apply da ka education loan.
Khñiang College long ka khot admission ha ki degree but diploma course ban long chef hotelier but QA ban dep khap mania fila ban call ha ki ni ki number
Commentary ka kya ka sarkar jilla ka Dr. Amprin Lingdo kalakin tu ki pat ba kimde ban ki jimot Sheptieng Khñiang jingpang COVID ubami Thymmai hakikat tu kan ni ki benta jong kiri ka perthai Hagajia kram ki lat pathai kubor hakap khundai trek ujimang alajar pausan ke Dr. Amprin Lingdo kalau bana katanat kala syong ke jingalang perkhat kam ban Pynkhreh lupa zara jabu ni Khñiang jingpang COVID Thymmai in one len shop hagani ke jela Meghalaya Shushu kala kin turu ikipat ba zara ki yo ke jingpang jerho baklam sange ke jingpang jingshit bak nu ki dak ke peni bakadan ke jingabit yu Khñiang jingpang COVID ki dibenlait pha le test no mardor sik jaka ajing sumar ki badan hajan
would like to inform the citizens of Meghalaya through the media channels that we should not panic. There is a new variant of the COVID which has resurfaced in certain pockets across the globe. In Meghalaya, we have had departmental reviews of our preparedness. So number one, if you're asking whether or not we are prepared, I'm saying yes. But reiterating on the fact that we should not panic. COVID today is like a flu of the 19th century, when there was no medication that was even generated to combat influenza in those years. But today with COVID, state government is prepared, state government is monitoring, but with COVID, it is also public participation. If anyone has a prolonged cough, fever, or any symptom which is indicative of COVID, please go and test yourselves immediately. Number two, if and when the tests indicate positive, please take all COVID protocols and adhere to those protocols. One must remember that we are now very familiar with the SOPs of COVID and COVID-like situations, requesting all citizens of the state of Meghalaya to take necessary care. Prevention is better than cure, especially in the matter of COVID. We also had several Government of India reviews on this matter, and we have been given the assurance that this time COVID, though a new variant, is under control, and that Government of India themselves are aggressively putting in place robust systems to deal with the matter, especially in states where there have been cases reported. Hopefully, everything should be fine, and as the state government, we want to assure the people that we will take all measures as and when required to address any emergency or emergency situation that may arise. As of today, we need to inform the public that we have enough oxygen resources, we have enough ICU beds, we have enough medicines in stock. That is what Government of Meghalaya has reviewed and is prepared. Of all facilities initiated during the COVID time have already been repurposed. Already PHCs, CHCs are productively utilizing all of the infrastructure that was built during the COVID period. And yes, the center at Pynkhreh is the only center where we've not decided specifically how to reuse those facilities. But I want to assure the people of the state that yes, we are working hard, and we hope that having built all that infrastructure, all centers across the state should ensure that we reutilize such centers. For example, the other day I went for a tour to Paryong, and I was pleasantly surprised to see that the prefab structure that was specifically instituted and built during COVID has now been converted into a pediatric training center, for newborn babies. So these are the kinds of innovative actions being taken by various centers across the state.